There is a plant that grows wild across the swamps of Florida. For centuries, the Seminole people crushed its berries to treat urinary problems and prostate swelling. By the 1990s, European doctors were prescribing its extract as medicine, proven as effective as pharmaceutical drugs, but without the sexual side effects. Then American supplement companies flooded the market with something else. They called it by the same name. They put it in the same bottles. They charged the same price. But it was sawdust, literally ground up, dried berries that contained almost no medicine at all. The real cure disappeared from American shelves while Europe kept prescribing it. Millions of men bought bottles that couldn't possibly work. And when they failed, American doctors declared the whole plant useless. This is the story of saw palmetto, the prostate medicine that worked, until the industry made sure it didn't. Welcome to Nature's Lost Vault. The archive opens in the pine flatwoods of northern Florida, 1835. A young Seminole healer named Osceola watches Spanish missionaries burn fields of native medicine. Among the ashes, one plant refuses to die. Serenoa repens. The saw palmetto. Its roots run deeper than fire. Its berries, dark as blood, ripen every autumn. The Seminole knew. They crushed the fresh berries for difficult urination, for the weakness that comes with age. The plant gave without asking. By the 1800s, American physicians listed it in medical texts for bladder inflammation and reproductive health. In 1906, saw palmetto officially entered the United States Pharmacopeia. It was medicine, recognized, documented, effective. Then came 1950. The Pharmacopeia dropped it. No explanation, no failure of efficacy, just removed. But across the ocean, something different happened. In Germany, pharmaceutical researchers were not grinding whole berries into dust. They were extracting the oil, the lipidosterolic fraction, fatty acids and plant sterols concentrated to 85% purity. They called it permixin. By 1983, it was approved in Germany and France, not as a supplement, as a prescription drug. Doctors prescribed it for benign prostatic hyperplasia, the condition that affects half of all men over 60. The frequent urination, the weak stream, the waking up 3 times a night. And it worked. In 1996, a landmark study compared this extract directly against finasteride, the drug pharmaceutical giant Merck had spent $450 million developing. The study followed 1,098 men for 6 months. Half took the drug, half took the saw palmetto extract. The results were identical. Symptom scores dropped 37% with the plant, 39% with the drug. Urine flow increased. The prostate shrank. But sexual function told a different story. Finasteride caused significant erectile dysfunction and decreased libido. The plant matched the placebo. 0 side effects. In 2002, another European trial compared it to tamsulosin, sold in America as Flomax. 811 men across 11 countries. The symptom relief was identical, but the drug caused retrograde ejaculation in 11% of men. The plant caused it in 1%. Europe embraced it. In Germany, 90% of men with prostate issues receive saw palmetto as first-line treatment. France and Italy followed. It became standard care. Safe, effective, cheap. And that was the problem. In the United States, a different market emerged. Dietary supplements are not regulated like drugs. There is no requirement to prove efficacy, no standardization, no oversight. By the early 2000s, American shelves filled with products labeled saw palmetto. But most were not the concentrated oil used in Europe. They were berry powder, dried waste ground into capsules. The extraction matters. The berries contain 10 to 15% lipids. The medicine lives in that oil. European pharmaceutical extraction concentrates it to 85% fatty acids using hexane or supercritical carbon dioxide. Berry powder skips the extraction entirely, just dried berries crushed into dust. The fatty acid content drops below 1%. Almost no medicine remains. But the labels looked identical. The bottles sat side by side. The prices matched. Consumers had no way to know they were buying dust instead of medicine. Then came the final blow. Between 2006 and 2011, the National Institutes of Health funded the largest American clinical trial, the STEP trial, which stands for Saw Palmetto Treatment for Enlarged Prostates. 225 men with moderate to severe symptoms received 320 milligrams daily for 1 year. The results were clear. It failed. No better than a sugar pill. In 2011, the American Urological Association declared that saw palmetto has no proven benefit. Doctors stopped recommending it. Insurance would not cover it. The plant was dismissed. But nobody asked the critical question: what extract did they use? The published study never specified. The fatty acid profile was never tested. The purity was never verified. It was a generic American supplement pulled from a shelf. In 2023, urologists at Weill Cornell Medicine finally exposed the truth. Dr. Bilal Chugtai and his team purchased 28 saw palmetto products from Amazon and major retailers. They tested every one. The results were devastating. The United States Pharmacopeia standard requires 80% total fatty acids with a specific lauric acid fingerprint. Not a single berry powder product met that standard. Some contained less than 1% fatty acids, 1/10 of what the label claimed. Dr. Chugtai stated it plainly. The question becomes, in the major American trials, would the saw palmetto used meet USP criteria today? You have to look at the data with a grain of salt. Translation: the trials that killed saw palmetto's reputation used products that were essentially sawdust. Only one product in the entire study met the full pharmaceutical standard, 1 out of 28. This was not accidental. This was structural sabotage. Merck's finasteride generated over $600 million annually at its peak. The global prostate drug market reached $2.3 billion by 2022. A botanical extract that worked just as well, cost a fraction of the price, and preserved men's sexual function, threatened that entire economy. So the industry chose chaos. They allowed worthless berry powder to flood the market. They ran trials using inferior products designed to fail, and when those trials failed, they dismissed the entire plant. The supplement companies won by selling fake products. The pharmaceutical companies won by maintaining drug revenue. The only losers were the men who bought bottles of dust believing they contained medicine. To understand the full tragedy, you have to understand how the plant actually works. Inside the male body, testosterone converts into a more potent hormone called dihydrotestosterone, DHT. DHT is essential during puberty for male development. But as men age, DHT becomes a problem. It accumulates in the prostate gland, binding to receptors and signaling the cells to multiply. The prostate grows. It squeezes the urethra, the tube that carries urine, like a kink in a garden hose. The stream weakens. The bladder never fully empties. You wake up 3 times a night. Finasteride works by blocking the enzyme that creates DHT, 5-alpha reductase. It shuts down the conversion completely, but it does so indiscriminately, often crushing libido and sexual function in the process. The saw palmetto extract performs the same function with surgical precision. It inhibits 5 alpha reducts, both type 1 and type 2 isoenzymes. It reduces DHT in prostate tissue by 50%, identical to the pharmaceutical, but it does so gently, without obliterating the body's hormonal balance. It also acts as a natural anti-inflammatory, reducing the swelling that creates urgency. It relaxes bladder smooth muscle, improving flow. This is not folk medicine. A 2005 study at the University of Arizona confirmed the mechanism. The lipidosterolic extract inhibits the same pathway as finasteride, but with none of the systemic side effects. It was published in peer-reviewed journals. The science was never in question. What failed was honesty. Today, if you search for saw palmetto, you will find hundreds of products. The best sellers are usually the cheapest. Berry powders that cost pennies to produce and contain almost no medicine. The few quality extracts, the ones standardized to 85% fatty acids using supercritical carbon dioxide extraction, cost more and sell less. They cannot advertise clinical benefits without triggering enforcement by the Food and Drug Administration. So they sit in obscurity while the dust dominates. Meanwhile, prescription drugs with black box warnings for depression, sexual dysfunction, and potential permanent side effects remain the gold standard. The saw palmetto did not fail men. The system failed saw palmetto. Men over 50 deserve to know this. The nightly bathroom trips, the urgency that wakes you at 2 in the morning, the embarrassment of a weak stream. These are not inevitable. There is medicine that helps. Real medicine. It grows from Louisiana to South Carolina, dense across Florida's pine flatwoods. The Seminole never lost the knowledge. They still harvest the berries in autumn. They still know the power lives in the oil, not the dust. European men still receive it as prescription medicine. Their doctors prescribe it first, before resorting to drugs that destroy sexual function. It works for them because they receive the real extract. America chose profit over outcomes. We chose shareholder value over patient care. We allowed an entire industry to replace medicine with dust and call it by the same name. The pattern repeats. Amaranth was banned by conquistadors. Tepary beans were erased by machines. Mesquite was cleared for cattle. Fava beans were replaced by pills. Indigenous crops that heal without corporate control are systematically sabotaged. Not because they fail, because they succeed without chains. The saw palmetto survived by being unkillable. Its roots run too deep. Its berries ripen every year. The medicine never left. But in American bottles, it was replaced with sawdust. The plant waits in the same swamps it always did. Dark berries heavy on the stem each autumn. The knowledge lives in Seminole hands, in European prescription pads, in the soil of Florida flatwoods. What was lost was not the medicine. What was lost was the honesty to deliver it. If this vault opened something for you, subscribe to Nature's Lost Vault and hit the bell. Every like and every share preserves what they tried to erase. The next vault opens soon.